I'm here with Victor Gonzalez, a retinal specialist and medical director of the Valley Retina Institute, and that is in McAllen, Texas. He's also head of Retinal Research Center in Valley. It's part of Valley Retina Research. Victor, thanks for joining us today.
Well, thank you for having me.
Appreciate it. So, Victor, the buzz at this meeting at ARVO has been OCT innovations, and particularly, swept source OCT seems like it's alive and well in the field. Triton out from TopCon has been buzz at this meeting. Can you tell me a little bit more about what's going on with Triton?
Well, a lot of retinal diseases are diagnosed using the OCT.
Yeah.
When we examine the patient, we quite often do not see what's happening at the cellular level and at the structure of the retina. And the OCT has always been very useful for us. The problem with the previous OCTs is that they did not have the speed that the swept source OCTs have, nor did they have the penetration of the imaging. So instead of just taking a view of the surface of the tissues, now we can look through all the retina and into the underlying tissues, into the choroid. So that's the real excitement with this type of technology. The Triton is one of the newest class swept source OCTs to come to this country. And we're very excited because it's one of the first instruments that, aside from having the ability to take fundus photographs, autofluorescence, the standard fluorescein angiograms, also comes capable with swept source OCT, and eventually will have the ability to perform angio OCTs as well, and I'll detail that a little bit later. I think that it's a machine that it's all inclusive, so it saves space. It saves having to have multiple capital expenditures, and the biggest seller to me is the fact that it provides us with information that is invaluable. It's priceless, and in order for us to be able to manage and take care of our patients.
Now, there's wide field OCT out there in the marketplace. And I understand it's possible that this type of swept source OCT, there's a sort of a 360-degree effect going on. Can you tell me more about that?
Well, that's one of the other important features of this device, and that is not only can you do swept source. The standard swept source area used to be 3 millimeters by 3 millimeters. We got somewhat excited when we went to 6 by 6.
Yeah.
A little bit more thrilled when we went up to 9 by 9. Then 12 by 12 came.
Okay.
Now, so we've expanded the area quite a bit, but the important factor here with this device is that we also now have a way to take some of those bigger images and splice them together and give us a nice broad view into the periphery, 360 degrees around the macula. And you may wonder why that's important.
Yeah, sure.
Well, there's indisputable evidence now that a lot of pathology, for example, in diabetes, doesn't start right in the back of the eye. So it's like taking an image in an area that's one of the last areas to be affected.
Yeah.
By having the ability to have a wider viewing area, now you're able to see it a little earlier. You can see it a little earlier. That's correct.
Fascinating. Well, what are some of the diseases of the posterior segment which, looking at the periphery better than ever is useful for?
Well, I think the obvious one I just mentioned, and the one that has the highest public health status is diabetes.
Okay.
And, as we improve our treatments of diabetes, as we start using more pharmacologic therapy, being able to view the periphery is very important. So that's the one that I think is going to have the biggest impact. But aside from that, there are conditions like different vitreal degenerations that occur. you can if you're in an isolated area and you have this device and you don't have any personnel that are trained to look at the periphery, you may be able to pick up things like retinal tears, retinal detachments, before they take the vision completely away in these patients. You can study and evaluate different retinal vascular abnormalities in the periphery. As we have found out, wet AMD doesn't always just occur in the posterior pole. Sometimes you can have some peripheral lesions causing some hemorrhaging and scarring. So, the application is broad. Now, there are a little bit more rare conditions, like in certain countries it would be very important. Sickle cell anemia can cause some abnormalities in the periphery as well. And these can also be detected by these types of devices.
That's a condition I haven't heard of for a long time, and certainly doesn't seem to come to the front of ophthalmology regularly. But sickle cell anemia, that's something very interesting that you mentioned here. So
and it's like diabetes. It causes occlusion of blood vessels.
Right.
And as it causes occlusion of blood vessels, you get sections in the periphery where you get atrophy of the retina and proliferation of vessels. And not a very well recognized problem, but we're getting better at picking it up early and sometimes detecting it in people who are carriers who never knew they had this.
Yeah. Now, so does that mean ophthalmologists eventually, with this new technology, can almost start diagnosing other general diseases even outside of eye care, just from seeing this with the new technology?
Well, the answer is yes.
Okay.
I mean, we are already able to diagnose hypertension, of course, diabetes. Having these broad images also allows us to be able to identify things like leukemias. I've diagnosed individuals with leukemia based on their peripheral hemorrhages and changes in the periphery. So, there is a very broad application of, being able to look at the periphery. And, it's true what they say, and that is the eye is the window to your soul. It really does give an opportunity to see a lot of what's happening in the rest of the body.
Now, I don't know if I heard this right, but also, speaking of windows, I heard that maybe it was the Triton device whereby you could image things like through, even if someone has a cataract, for example. Tell me a little bit more about that.
Well, see, that's the beauty of the swept source technology.
Yeah.
Okay. The swept source, an OCT works by sending out light.
Yeah.
Okay, and different frequencies. The frequency that's used for the swept source is broad enough that it can penetrate denser media. And that for that reason it can penetrate denser media like cataracts. I'll tell you what, I've had patients where there's been a little loose blood in the eye. I can't figure out why it is that they're having this unexplained bleeding in the eye.
Yeah.
And then I'll go to the optic nerve head, use the angio OCT on the Triton, and I can see a little plexus of neo vessels, new blood vessels growing. Helping me determine that this is probably diabetic retinopathy, and I know how to treat it.
No doubt. Fascinating. Well, I heard a talk at ASCRS recently by Dr. Eric Dunfeld. It was fascinating because he was talking about how, I believe oftentimes now for his premium IOL cases, he would definitely make sure that there was a pristine retina behind, the cataract, because otherwise you're going to have a post-op surprise. So it seems like with innovations here in the retinal space with swept source, you could also, for example, start to delve into the market of anterior segment surgeons and make sure what they're doing is optimal.
Oh, absolutely. I'll tell you, I have recommended to all the anterior segment surgeons in my community to do an OCT on all their premium IOL patients. And the reason for that is that not infrequently you can find some type of retinal pathology that could potentially have an impact on the visual acuity and the outcomes.
Right.
And, as you know, premium services means that they're paying for it.
Yeah.
And they want to make sure they have the premium outcome.
Sure.
And that's one way you can, assure them.
And maybe finally here, we're talking about swept source, of course, but how would you compare it to, wide field OCT or even spectral domain OCT? Is swept source OCT something for today's marketplace?
Swept source OCT is its time has arrived. I mean, there are a lot of conditions that as we are learning, you'll see some posters here at this meeting that show that looking at the thickness of the choroid, for example, correlates with activity of choroidal neovascularization. The swept source OCT can help you with that. There's a condition called central serous retinopathy that occurs in younger individuals who are, lead stressful work environments, like investment bankers and people like that. And again, this is a non-invasive way of looking at this. So the answer to your question is absolutely. This is a device whose time has come. I think that you will see that the devices of the future in this field are going to be swept source primarily. And the reason for that is that they've gotten faster. They've been able to give us much clearer images in wider areas. Spectral domain, don't get me wrong, is a good OCT.
Yeah.
But, why look at the surface 10 layers when I can look at the surface 10 layers plus the other 3 or 4 layers after that? It's...
Got it. Well, and final question here, if we look back through time, early 2000s, I remember there was time domain OCT. Spectral domain OCT was out there in the future. Here we are, where it seems like spectral domain OCT is sort of, conventional wisdom, so to speak, and swept sources is sort of here and also into the future. So where are we in today's marketplace? Are there uses for all of these technologies?
There definitely time domain OCT. There's really no use at this point in time. I mean, spectral domain OCT is so superior to it that now if you have a spectral domain OCT, and you're thinking of upgrading, then I would seriously consider a swept source at this point.
Okay. Well, great. Thanks so much for joining us here.
Thank you.
Glad you flew the friendly pie skies.
Thank you.